Hello guys, welcome to the video. Today we're going to be talking about what you need to know before becoming a nurse. Please enjoy. When I went into nursing, I kind of had an idea of what it would be like, what I was going to be able to do, how much money I would be making. I had an idea of how amazing it would be to eventually have the opportunity to save lives, because that's where I'm gonna be working pretty soon. I'm gonna be working in the emergency room. I just got hired in a level 2 trauma unit here in an emergency room nearby where I live, and I'm just super excited to start working there. A lot of people, when they think that they're gonna go into the healthcare profession, they think that it's gonna be glamorous, that it's gonna be, oh man, I get to work in a hospital, you know, I'll be wearing my nice scrubs. But it's not necessarily like that all the time. Like, you're gonna be seeing a lot of dirty stuff, a lot of vomit, a diarrhea. You're gonna be cleaning up things you never thought you would have to clean up before in your life. So yeah, that's definitely something that you gotta be aware of. It's something you gotta have the stomach for and be able to can handle being in those situations, you know, and being able to take care of your patients no matter what they may be going through. So that's something that it's kind of a misconception, what they don't show on TV, but in reality what we do is sometimes we have to get down and dirty. But on the flip side to that, it is amazing to do things, to be able to work in the hospital setting. Especially if you work like in areas like in the emergency room or in critical care units, you get to immediately impact your patients' lives for the better, and that's something that it feels amazing to do. You know, I remember when I was in clinical, we had the chance to bring somebody back to life. Somebody was pulseless. We did CPR, and you know, we brought them back, and that was something that was really amazing to do, is to help someone come back to life. That's something that gives you such a passion, such a thrill, such a drive to be able to practice more of medicine and become better in your field. And that's something that I really do love doing. So there's kind of your con and your pro of working in the healthcare setting. Another thing you need to know about healthcare nursing is male nurses exist. Guys, ladies, we are here. We're here to stay. So there is male nurses, and sometimes there is a misconception of what nurses do. It's definitely a woman field. There's a lot of women in the nursing field, and they are amazing. They're awesome. They're so smart. They know procedures better than some residents do, because they have the experience. So women are amazing, and my wife is actually in nursing school right now, so I'm super happy for the women, and they've paved the way for us men to come in here and be able to work. And that's something that it should be that's a misconception that only girls are nurses. There's plenty of guy nurses out there, and guy nurses that when I notice a lot of guy nurses is that they take the lead, they take charge. A lot of my preceptors in clinical were men, and I'm just like, I learned a lot from them. So it's not that misconception that only girls work in the nursing industry. That's something that we should like leave, because we're here. Us guys, we're here. Another thing that you have to know is, yeah, we work only 3 days in the week. That's full time. But it's 12-hour shift, guys, and that's something that is really hard. Like, doing 12 hours on your feet, and it's no joke. So it does take a toll on you, especially if you work nights. That I will be working nights, so that's gonna definitely throw off my circadian rhythm. I remember when I would work nights as an LPN, it was one of the toughest things I had to do, because it just messed up your stomach, it messed up your sleep cycle. It was really hard. So yeah, we work only 3 hours a shift, but you know, we're 24 hours. Nurses work 24 hours. There's 3 shifts in the week, 12 hours, either from 7 p.m. to 7 a.m. or from 7 a.m. to 7 p.m. So that's tough. That's a lot of work, and people underestimate. They're like, oh, you only work 3 days a week. That's nothing. But no, it's a lot, especially if you pick up overtime. It's really stressful, and it's a lot of work. And guys, before you become a nurse, if you're watching this video and you're like, oh, you know, I kind of want to go to nursing school, see how it is, you should do it. There's definitely an associate's program you guys can do in 2 years, or there's a bachelor's that you can do in 4 years. But just know that it takes a lot of hard work and dedication. Like, it's not something easy. It's a lot of information to cover. It's not that the information is hard per se. Like, if you study, you can understand it. But it's just so much to learn in such a small amount of time. And that's one of the challenges that nursing school is, and the nursing profession is as well. Another thing that you guys should know before becoming a nurse is money. Alright guys, a lot of people think, oh my gosh, nurses make the most money in the world. They're swimming in it. No, like, it's not easy money. Like, especially in the beginning, you know, you're not going to be getting paid the most highest salary. You know, you definitely have to work your way up to getting a higher range of salary. That being said, nursing is definitely a good paying, well established job. So if you want stability in your life, you know, like everybody else, nursing is definitely something that gives it to you. It's a good stable job. You know, sadly, people are always going to be needing our help, our profession. You know, we're definitely gonna have to be doing this for the foreseeable future. So that's why it is a stable income. It is a stable job for the moment. Something else you guys should know is make sure that this is something you really want to do. If you go into nursing just for the money, for the stable job, for the growth aspect of it all, you're not gonna find happiness. You're not gonna enjoy your job. It's gonna be very difficult, because it's very demanding, it's stressful, and you know, you have people's lives in your hands. So that's something that you got to know. It's something that you got to make sure that you're willing to handle with that stress before you enter the nursing profession. And the last thing that I'm going to mention to you guys today, something you have to know, you need to know before becoming a nurse. There's growth opportunities, guys. There's so much you can do with your nursing career. It's not just at the bedside. You can be a legal nurse consultant. You can work as a nurse practitioner. You can become a CRNA. You can become a DNP. You could go teach. You can do so many things with your nursing career. It's not just bedside nursing. So there's so much you can do out there, guys. There's so much growth potential. You can go into management and make more than 6-figure salaries. So there's definitely a lot that you guys can do as a nurse. There you guys have it. A couple things you guys should know before you enter your nursing career. But keep in mind that nursing is amazing. It's really awesome. It's a really good career, and I truly feel like nurses are the backbone of a hospital. You know, without nurses, hospitals can't run, and that's why I feel like it's such a great career path to take. So I hope you guys enjoyed this video. If you're thinking about going into nursing school, or want to go into nursing school and want to start this nursing profession, comment down there below. What are some insecurities? What are some questions that you guys might have? Please let me know. We can always make a follow-up video and explain more, and I'll definitely get back to you guys in the comments. And like always, much love.